Good morning, good afternoon, and good evening to wherever you are joining us from today. My name is Colleen Emery, and I'm going to be one of the hosts on today's call. We're really glad that you are here, and we're going to just wait a minute or two as I see the numbers of participants are increasing as I'm speaking here. But before we do start, I want to note that there is translation today available for you. The call is translated from English to Arabic, Spanish, and French. And we have Arashid, Marie, and our Spanish interpreter, whose name is Miguel. And we thank them for their services today. So just a reminder that to access the interpretation services, you click on the interpretation button on the bottom of the screen. Next slide, please. So let's get started today. Welcome to our second ECD topic that we're covering. We are really glad that you're here. And today is all about the practical tools that we are able to use in our programs in emergencies. And so we're going to hear from a couple of examples where these tools have been put into use. Next, before I move on, I just want to note some housekeeping items. We're going to record this call today, and those the slides and the recording will be shared with you afterward. We welcome to introduce yourself in the chat on the call. If you could just say who you are, where you're listening from today, so we can get to know each other that way. A couple of other housekeeping items before we start. If you can keep your mics on mute, and if you can keep your cameras off, please, so that we can preserve the bandwidth of the internet for everyone on the call. If you have any questions as we go along for the presenters, you're welcome to put them in the Q&A box. And you'll see that next to the globe icon on the bottom of your screen. We will have a Q&A time today, and we will endeavor to get to all of the questions. But if they are not answered in the webinar, we'll be sharing a summary of the questions that were received and the answers after the call. So we encourage you to use that Q&A box. Okay, and as you the next part I just want to talk about is who the group is that is organizing or has organized today's call. We have a working group that has been working behind the scenes to put today's webinar together. And the organizations that are members of that group, their logos appear on the screen here. And we thank this group for their hard work in putting today's webinar together. We also want to acknowledge the support of the agencies that provide the funding that allow us to do this work. So thanks to each of them, and they also appear on the screen here. Next slide, please. So we have two objectives for today's webinar. The first is to look at how this topic can be integrated into our field programs. And so you're going to hear some practical examples on how this is being done. And then, as I mentioned, today is all about the tools, the practical tools. So in this second example, you're going to hear about two field programs that have been using tools. We're going to hear about what they've done and practical ways that they've been able to integrate these tools into their existing programs. Next slide, please. So our agenda for today, before we kick off to the presenters, I'm going to take a moment to introduce them, and then we're going to have, as I mentioned, two country examples for us today. And following those presentations, we will have a question and answer session, and then we'll have a few closing comments at the end. And the webinar should last just over an hour today. Next slide, please. So this is everyone who is involved on today's call. We have myself, Colleen Emery. We have Eduardo Roland from UNICEF. We have Andrea Garcia from Save the Children. We have Dr. Saholi, who represents the Ministry of Health from Madagascar. We have Michelle Jadiel Kosu, who's going to be co-presenting a country example. And then we have our representative from the International Orthodox Christian Charities. Her name is Bayan Ahmad, and we are grateful for all of you that are here today, and we look forward to hearing from you. Next slide, please. So without further ado, I'm going to pass the floor over to our first example to share their experience. So I'm going to pass the floor over to you, please. Dr. Saholi and Jadiel, over to you.
Thank you very much. The Ministry of Health will be with us for this presentation. We're going to show you the perspectives on the tests and the integration of the tools when we talk about acute malnutrition in Madagascar. Compiling the data we had, we noticed that parental implication and activities putting forward the stimulation of children between 2 and 4 is limited, approximately 5%. So a lot of children under 5 suffer from acute malnutrition with all the risks and that go with it. And they are very hardly helped. Because of where Madagascar is, we suffer from the various climate changes. In the southeast, you have cyclones, heavy rains coming back and devastate everything. And they today affect areas which were not in the past. In the south, there are recurrent drought periods and entailing terrible suffering for children who are the first victims and most affected by those climate changes. Facing this situation, initiatives have been developed to support the children and the families so that they can manage the changes due to climate changes. All the actors have been involved. The public health ministry, together with UNICEF, has established nutritional rehabilitation centers and continue in the communities with other partners. There have been orientation sessions with cluster members and psychosocial support for distressed children have been set up. Partnerships have been established together with the Pediatric Society to strengthen health workers in psychosocial care for managing malnutrition, and also integration of psychosocial support into the revision of the protocol for the prevention and management of malnutrition. In such a context, in ECD, in emergency situations, we have used those tools, which are called HOPE tools for our children. And their support is to help the parents and in the community, and also making sure that there's well-being of all the people in charge. They want to help those people understand and be able to look after the children. It's quite an interesting tool. and useful for our programs. And currently, we are just getting used to them, and we want those tools to be used, to be really used in the malnutrition programs. And changing theory has been developed, showing that nutrition is focusing on the early development and creating stimulation for everybody in the family. On this basis, it proved necessary to set up a pool of trainers, and it was composed of pediatrician from the society in Madagascar, people from the public health, people who work in nutrition, NGOs, local NGOs, as well as international ones, um, which work in care and implications. And this pool uh, tested the tests, and in the latest trainings, the various actors managed the main guidelines and axes with the help and support of the NGOs and the ministry. Once this pool was set up on this tool, uh, with the government and public health, we decided to test the tool and wanted to integrate it in the programs of malnutrition for ECD. And when we test the tools, we had recommendations of all the trainers. So we developed a protocol, a test protocol for those tools. And this test focuses on the dry areas, but also on the areas where the cyclone struck last time. And the test will be in the community as well as in the hospitals. Talking about the hospitals, together with the ministries, we identified 3 university hospitals in Madagascar where students could help and support us. But we want to make sure that we understand all the factors of the tool, and we want to have as many results as possible. And in those 3 university hospitals, we carried out tests. And so when the child has acute malnutrition with the complications and so on, the people in charge go through an evaluation at the beginning to test the mental health of the child, but also want to see what happens through the child. And so we want to have more tests so that we can actually see if there was a change and what the parents learned by themselves, but also what the children can understand through the commitments of the parents. And we've almost finalized this protocol. We had discussions with the university, and we have to finalize the discussions with them. And on the other hand, Madagascar has specificities. Most people speak the local language, and both tools have been translated in the local language and has been tested as well, so that we can adjust certain words together with the dialect actually spoken. So it's going to integrate in the local context. So everything is ready so that we can carry out the test. Talking about community as linked with the test, we've already translated the tool, and we use the nutrition programs as well, and we wanted to test them as well. So it's going to be over a longer period, and we plan about 6 months so that we can have a baseline. And after 6 months, we want to check how the parents manage the stress, when it comes to drought or the cyclones in Madagascar. And so, but also we want to see how the parents get involved with the children to stimulate them even more. And in this tool, there is a module dealing with games without a game. So the parents can game without a game, but also play with a game and with the World Health Organizations, which was actually recommending various other things, and we are very proud to see that WHO comes into that as well. And there's a link with the treatment as well. So we can use this support and stimulate the children. This is a commitment. There must be a commitment from the parents, and how the parents can make tools for the children and get involved with them. And this is a good basis for the parents to get interested in the design of children and so on. We want to strengthen that part as well, because we want that. So we're talking about various types of games, and this is a commitment from the parents who then get involved in these tests. But we're also going to take into consideration all the factors which may come into it when they are in hospital or elsewhere. We discussed with the various stakeholders, and we're going to integrate that in our existing programs, and with the actors of we got worked out a definition of 4 main axes. The first one is a social side. We want to help the parents with money, for instance. We also want to introduce this tool in our programs, in our health, nutrition programs based on communities, and in such areas where drought and cyclones are coming back year after year. And we also have displaced camps, and there we set up spaces where we can welcome people and children with psychosocial support, and we're going to take into consideration all the variables like ethnic ones, country ones, and so on. We want to integrate that in spaces as well, so that the parents and the people in charge of children can benefit from all that support and be stimulated. On the third level, as was said before, Madagascar is in the process of revising the protocol, the malnutrition and nutritional program, and we want a continuum, so intensive continuum, and we want to deal with and manage malnutrition. And after revising this protocol, we want to define the tools and the elements of both those tools, and we hope that they're going to give us a lot of strong bases and stimulate the parentality, and as we expect. And we worked with the Ministry of Population, and we hope that there's going to be a parental program set up. The tool is not in that, but the elements are in there, and there we will have games and toys and so on to take into consideration the stress parents are facing and transmit to the children after such cyclones. And that's what we're thinking and doing in Madagascar. This tool is going to reinforce the existing package. And we are in the process when the test is going to be integrated in our nutrition and ECD programs in Madagascar. Uh, 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 we want to thank you in the local language as well, which I can't repeat.
Thank you very much to the team from Madagascar for that presentation. Really interesting work you are doing, and thank you for sharing your experience with us today. So I'm going to move us now along to our presentation from the IOCC. So over to you. And before I do that, I encourage everyone to use the Q&A box. So you'll see that on the bottom of your screen. If you can put your questions in there, then we'll be able to address them after. Okay, over to you now. Thank you very much.
Thank you, Colleen. Thank you. Hello, everyone. This is Bayan Ahmad, the project manager with IOCC Lebanon. Just to give you an overview about IOCC, it's an international organization based in US and working in different countries, including Lebanon, and under different sectors, including nutrition. I'm here today to discuss the integration of early childhood development interventions into nutrition programs, mainly the UNICEF-funded nutrition project in Lebanon. Next slide, please. Before starting to discuss the interventions and the tools we are using in our project, I wanted to give you an overview about the situation in Lebanon. Lebanon have been facing several crises. He has the highest. He is one of the highest refugee population. He has the one. Sorry, he has the one of the highest refugee population per capita. We've been going through a severe economic situation since 2019. We have political instability, the currency collapse, and recently we have an unstable security situation going on since also October 2023. And all of these crises have put an immense pressure on the resources of the countries, the services, and also on the infrastructure. So we have now our public services and facilities, including healthcare, education, and social safety nets, are overburdened and underfunded. And all of these crises have also led to rising food insecurity and poverty challenges, which also impacted the children's health, nutrition, and development. And all of these crises have also led to have an urgent need for interventions that prevent malnutrition and that also support the children's growth and development amid these crises. Next slide, please. To respond to these challenges, UNICEF launched a rising initiative, which has been launched in partnership with the Ministry of Public Health in Lebanon. This initiative is a community and multi-sector initiative that aims to prevent undernutrition and early childhood development deprivations in Lebanon, and also to address the undernutrition among pregnant lactating women. This initiative includes key essential nutrition and development interventions that aim to enhance the adequate diets, also the nurturing care practices, and also the nutrition services. Next, please. One of the key interventions of the Rising Initiative is the establishment of the Early Childhood Development Corners. These early childhood development corners are as safe spaces to the caregivers and their children to receive the essential nutrition and early childhood development activities and interventions. They are usually being established at the community level in a room that is either in an informal tented settlements or in the municipality or in any place that is close to the community. We are establishing these ECD corners. The minimal requirements for these corners is that to have a quiet, clean, well-lit, well-ventilated, and a safe space, ensuring confidentiality for the beneficiaries, and to also have a minimal required setup to have a table and chairs for safe and comfortable use by both child and caregiver, a mat for interaction between the child and caregiver that allows observation, and also a support from the staff working in these corners. Next, please. The services that are being provided in the ECD corners, I will start by the one-on-one counseling. These counselings are usually being conducted by IYCF and ECD counselors. These sessions are tailored sessions with caregivers. They usually take 30 to 60 minutes, and they provide the space to observe the interaction between the caregiver, and they let the counselor check the child's progress using development milestone cards that I will be talking about in the next slides. Also to check the health status of the child, the vaccination, the nutrition status, and for the counselor to provide, can we go back? Yes, thank you. And also to provide tailored guidance based on the assessment that is being done by the counselor. And the milestone cards that are being used, they are being conducted at key child milestones. This means that at 2, 4, 6, 9, 12, and 18 months, and also at 2, 3, and 5 years, to be able to track the progress of this child from birth until the age of 5 years. The other service that is being provided at the ECD corner is the group sessions that are also being done by the counselor. These group sessions are conducted to share information with the caregivers, disseminate also the key messages related to early childhood development, and also that allows the caregiver to share their experiences, their feedback, their challenges together, and that may have practical experience to share with each other. Next slide, please. The third service that is being provided is the home visitation. The home visitation provides the opportunity to make direct observation on home environment, family structure, the roles, the relationships within the family and caregiver, and to see the whole environment the child is living in. And it also gives more time and privacy for the caregivers to raise questions, to seek clarifications, and also to sort out some problems. And it's also allow the counselor to follow up on the child's progress, specifically the problems that were being identified during the one-on-one counseling or the group counseling done in the ECD corner. And one of the services that also is being provided is the group play sessions with the children and caregivers. And this allows also for more interaction and communication between the caregivers and the children. And also it provides the caregivers with ideas that are age appropriate and low cost, and that also that can be used from simple household items for the caregivers to create some, for example, playing tools or activities for the children at home. And this activity enhanced the play and communication between the caregiver and the children. Next slide, please. Regarding the tools that are being used by the counselor, I will start by the ECD kits, the early childhood development kits. This kit is usually provided by UNICEF. It provides a range of activities to encourage the development and social interaction of children. It includes, for example, coloring papers. It includes balls for the children to play, a puzzle, for example, and other activities that could be used by the caregiver and the children during the counseling session to see the interaction, the communication, and the social and development milestones of the child. And next, please. The other tool, which is also the most important tool that is being used, is the integrated ECD milestone card. This card is being used by the counselor to screen and assess the early childhood milestone of the child at each age. And as I mentioned before, there are age-specific cards. They cover the ages at 2, 4, 6, 9, 12, 18 months, and also at 2, 3, and 5 years. They help assess the social, emotional, communication, cognitive, and physical development at each age. They also help help identify the practices to support child development and guide the caregivers on actions if milestones are unmet. They also help to provide advices to the families about the issues in child development. They provide age-appropriate vaccination information and the actions for missed immunizations. They also provide brief assessment of childhood illness, and we will see this in the next slides also. And the next steps is if the child is unwell. They also allow the counselor to screen for malnutrition using the MUAC, also the weight and height, and also to track the progress of the child, and to explain the results for the caregivers and provide age-specific nutrition guidance, and to conclude with the key points to help the caregivers with the childhood development of their children. Next slide, please. In this slide, I'm giving an example about the age of 1 year, but as I mentioned before, that we have milestone cards for the different age that I mentioned earlier. We start with in these cards by collecting the child's biodata, for example, to take their name, the name of the caregiver, what is the relationship of the caregiver to the child, the gender, also the age of the child, and any other information that we feel that is important to have. Next slide, please. The second part allows to assess the developmental milestones, and as we can see in this slide, that we can the counselor should observe and complete this checklist with the caregiver, and it contains it includes social emotional milestones, language communication milestones, cognitive milestones, and also movement and physical developmental milestones. In this part, the counselor usually asks the caregiver, for example, to play some games that are relevant to the age of the child, and to observe how the child is acting, or for example, to do some actions in front of the child and see if he can copy, for example, the simple actions that the caregiver is doing. For the language, for example, if the child is calling the parent as mama or baba or any other special name depending on the location, if he can, for example, repeat single words and sounds, if he can wave bye-bye for the caregivers that is present with the child. We also assess the cognitive milestones, for example, by asking the caregiver to ask the child to put something, for example, in a container, and see if the child will interact with the caregiver and do this activity. Or for example, if he can point with the finger of the caregiver. And also we can observe if the child, he pulls out to stand, for example, if he walks holding onto furniture. So we observe the child, and we observe the different milestones depending on the age of the child. And here the milestones varies from one milestone card to another depending on the age of the child. Next slide, please. So before moving to the next slide, if we can go back for the yes. If the child is not meeting one or more milestones or has lost the skills he or she once had, in this case, the child should be referred to specialized care or to the nearest primary health care center. It depends on the milestone that he is missing. So the counselor should, in this case, refer the child to a specialized care. Next slide, please. The second part is about the MUAC screening. The counselor usually take the MUAC of the child, and they write down, if, for example, the result of the MUAC screening, if he is identified as a moderate acute malnutrition case or SAM case, or he is at the risk of malnutrition, or no risk has been identified, and also what the action that should be taken in this case. For example, if we have identified any case of acute malnutrition, we should refer this case to the nearest treatment center for acute malnutrition. And also from the assessment of the counselor with the caregiver, she checks if there's a need for an IWSF tailored counseling, if there's a need to refer this child for PHC for example, medical examination or nutrition assessment, or if there's a need to refer them to other programs like food security programs, social protection programs, cash programs, or any other programs. The third section is about the growth monitoring, promotion, and referral. In this section, the counselor should take the height and weight of the child and check the Z-score on using the growth charts to also check if the child has stunting, has wasting, has overweight, underweight, or if there's no risk has been identified, and also to take the action as needed, for example, to refer this child for acute malnutrition treatment or for PHC for example, medical examination. Or to, for example, refer the child and the caregiver for nutrition counseling, IWSF counseling, or any other assistance needed as per the further assistance needed as per the assessment. And if there's a need to provide the child with supplements, we also provide the child with supplements, macronutrient supplements, depending on his age, and also the guidelines that are being released by the nutrition sector, depending on the case of the child and the age of the child. Next slide, please. Then the fifth part is about the immunization. Also these parts varies from one cohort to another. It depends on the vaccination calendar based on the age of the child. So the counselors should also check if the child has received all the vaccines that should have been taken. And if there's a need, if he's missing any of the vaccines, the counselor should refer this child and the caregiver to the nearest primary healthcare center to have their vaccines, and also if there's a need for any specialized care in this case. And also the counselor should check if there's any danger signs that have been noticed with the child. For example, she needs to check if the child is being able to drink or breastfeed, if he is vomiting, if he had any convulsions, if he's lethargic or unconscious, if he has cough, fever, or diarrhea, and refer the child accordingly either to pediatrician and primary healthcare center, or to hospital, or to a pediatrician, and to give also the needed advice in this case. And also to check some developmental danger signs, if he is able to follow moving objects, for example, or to turn his head when someone is talking to him, and if he is reacting to loud noises, and also if any of these signs is checked for no, the child in this cases should be referred to PHC or to the pediatrician for specialized care. Next slide, please. At the end of the assessment, the counselor should also provide the caregivers with the needed tips and the best practices to be followed depending on the assessments being done. And also she should check if there's a need to follow up with the child and the caregiver, if the child the caregiver should return with the child to the ECD corner to be followed up, and also to tell the caregivers about the period on when they should bring back the child to the ECD corner to be followed up. Or if there's a need to conduct a home visit to check, for example, the environment of the child where he is living, or if it could be done over a phone call, for example, and there is no need for a follow-up visit or for the caregiver to bring them back to the ECD corner, or if there's no need for a follow-up visit. And I mean here for the follow-up, not for the follow-up for the other ages. For example, if the child is 2 months old, he needs to come back to the ECD corners, for example, at 4 months, 6 months, to track his progress. But I mean here for the follow-up, if there's a need to follow up with this child in a period that is less than 2 months, or it's nearer than the next milestone that should be followed up with the caregivers. Next step, next slide, please. Also scan and one also click, please. For the other tools that are being used, we have the CCD counseling cards. It's in Arabic, and it's being provided to the counselors to use them in their sessions to provide the tips for the caregivers about the child development. And it includes tips at different ages, starting directly after birth until 1 week of age, then from 1 week to 6 months, from 6 months to 9 months, 9 months to 12 months, 12 months to 2 years, and 2 years and above, and to provide the caregivers with tips for each milestone about how to react, for example, with the child, especially in regards to responsive feeding, to the play and communication with the child, and the different topics related to ECD. Next slide, please. The other tools that also are being used by the counselor are the cradle poster that is also being developed by UNICEF. It also includes the different milestones of the children, also at different ages. So we can, for example, see the movement, the milestones regarding the movement, social development milestones also related to language and any other related milestones. And other tools that are being used, we have 9 short episodes that were also being launched by UNICEF in coordination with the Ministry of Public Health, and there were you can find them on YouTube and also on the social media platforms of UNICEF. They follow the development of 2 twins that are Hala and Hadi from their birth until the age of 5, and they highlight the different developmental milestones as well as essential nutrition tips and guidance to support caregivers' growth. And they are being used by the counselor during the session and the one-on-one counseling sessions, also to help disseminate the message with a visual tool that helps the counselor to also disseminate the message to the caregivers. And the other tools are the ECD modules. We have also 19 modules that have been developed, covering several topics related to ECD. For example, we have the nurturing care practices, the caregiver skills, play and communication skills, and also how to promote, for example, the parent-child attachment and many other topics. And they serve as a reference guide for the counselors, also to be equipped with the skills and knowledge needed in this regard. Next slide. Okay, and the other needed tools for the ECD activities is the MUAC tapes, because as I mentioned before that they need to take the measurements, the MUAC measurements for the child, so they need to have the MUAC tapes with them, and also the growth monitoring charts for boys and girls to be able to track the growth of the child, and to, after taking the weight and height of the child, to be able to calculate the Z-score using the growth monitoring charts. And they also have the weight scale and a portable height board to be used also in the ECD corner, and also the referral forms whenever they see there's a need to refer the child either to PHC or to any other services, so they can use the referral forms to refer this family. And also the ECD monitoring forms. These ECD monitoring forms are being used by the supervisors to be able to monitor and supervise the activities being conducted in the ECD corners that are related, for example, to the one-on-one counseling, the group sessions, the playing sessions, and all the activities being done in the ECD corner. I think this is, yes, the last slide. Thank you.
Thank you, Bayan, very much for that really interesting presentation and for really explaining to us all of the different tools that you are able to use in your programs. So now we're going to move to a time of Q&A. So Andrea and Eduardo, I'm going to pass it to you for you to lead us through this Q&A time. Thank you.
Thank you. Thank you very much, Colleen, and thank you all for being here. The almost 100 participants in this webinar. The box on questions and answer is very active, and some questions have been answered. We will answer all the questions that you put there on the questions and answer box, and if we don't have enough time during the webinar, we will be sure that we go through them and we'll reach out to you to answer all the questions. But in the meantime, there are a couple of questions that are there that I think are important for the presenters. And first of all, thank you very much, our colleagues and friends in Lebanon and in Madagascar. Andrea, do you want to present one of the questions from the questions and answers for the presenters?
Yes, thank you, Eduardo. I can start with the first one here. This one is for Bayan. The person wants to know if the one-to-one counseling and the group sessions are monthly conducted or how many times per month. Bayan.
Yes, Andrea, but I wasn't able to listen the first part of the question. If you can please repeat it.
Yes, of course. It's about the one-to-one counseling and the group sessions. They want to know how many times per month are conducted.
Okay, so for one-on-one counseling, there is no fixed schedule for this one-on-one counseling. It depends on the need and the issues that are being identified by the counselor when doing the one-on-one counseling with the caregiver. For example, if the counselor identifies an issue related to IYCF and another issue, for example, related to responsive feeding, and another, for example, issue related to the child-parent attachment. So she needs more than one counseling session with the mother, and it depends on the topics that should be they should talk about. So there's no fixed schedule for the one-on-one counseling. For the group, for the one-on-one counseling, it depends on the issues and the need for the follow-up. For the group counseling sessions, usually we try also to combine more than one topic in one group session, because we know that there are challenges in having the same caregivers attending the same groups at the same time. So we try to cover 2 to 3 topics depending on the also attendees, the targeted populations in our sessions, and we do a tailored session for these groups. Also, there's no fixed schedules for the group sessions, but we try as much as possible to cover all the ECD related topics, and for example 2 to 3 sessions, and trying to cover 2 to 3 topics, for example, in one session, depending on the schedule of the caregivers and their availability to have them also regrouped for more than one session.
Thank you, Bayan. Eduardo, do you want to go with the next one, please?
Yes, I am monitoring the questions and answers, and there are a lot of them, which is a testimony of the richness of both presentations and the many tools that have been presented. There are several questions regarding the cards, and I don't know, Sania, we can give an open mic to maybe either Najwa, or they are asking more. How do you well? First of all, people want to see also those materials, and we will have to see if we can share them. That's a question for both Madagascar and Lebanon. But in particular, these cards, there are some comments there and questions of how do you work with these cards, and if it seems like oftentimes those cards, including also milestones, etc., are not kept by the families. So what do you do, and how do you manage them, and how do you ensure that they're actually used by the families after the visits?
Okay, so what we usually do, we don't give these cards to the family, directly to the family, but rather we explain to the caregiver about the results of each section directly to the family. And we used last year to have these cards as hard copies. So each time the counselor had to write down the information directly on the hard copies. But this year we shifted to have a digital form. We inserted this information on Google Sheets for easier also monitoring, also for easier for us to be easier for us to reach also the information if it's on an Excel sheet rather than have it on hard copies. So for the staff, they insert all the information on Google Sheets, and whenever they need to do any follow-up with the caregiver, they have like a reference code that we can go back directly to the, for example, the milestone of the age of the 2 months, and now we are doing, for example, the assessment at 4 months, so we can also compare and tracking the progress of the child. But for the caregivers, we do not give them the cards. We rather inform them about the results of the assessment. And they are easily accessible for our staff because they are, we can extract the Excel sheet and have them directly with the staff to use the information that were being collected.
Great, thank you, Bayan. Andrea, do you want to ask the next question?
Yes. Sorry, thank you, Eduardo. The next one is related to the assessment of milestones. People want to know if this assessment is conducted by community-based volunteers, or is it health or nutrition staff who is doing this assessment, and if the playing materials are provided for all children.
I will start by answering the second question. The playing materials, they are not being provided to the children. They are being used in the ECD corner and also to observe the interaction between the caregiver and the child. So we use them in the ECD corner and we keep them in the ECD corner. So we do not provide them to the children. Regarding the background of our staff, we usually try to have our staff have health and nutrition background to be able to assess, to go over all the parts of the assessment, and having this background as health and nutrition. The counselors are mainly either midwives or nutritionists, so that they can give the needed counseling for the caregivers related to nutrition, to child development, and also to health.
Can we ask the same question also to Madagascar to understand a bit better the composition of the personnel of the staff, and how do you work with professionals or more staff people and volunteers involved in the early childhood development activities in centers or whatever those tools are being used? Pour les Madagascar, est-ce que vous pouvez nous aider à comprendre un peu plus les structures des gens que vous êtes pour faire les activités de développement de la première enfance dans les centres ou là où vous
Oui.
utilisez les outils?
Yes, thank you. So in Madagascar, we work with the Ministry of Health, and we have community agents who support us for the grid, for the development grid. We have a health book for each child, and there we have all the development grids and scales. And so when the child comes there, the health agent comes and supports and fills in the various details, and then the detail is shared with parents and so on. We tell them where the child is in its development, and when the child has a late development signs, then there is therapy, stimulation therapy, which is prescribed to the parents, and this is under the control of the health center, and those agents would come and visit the family as home visits, and they follow up the child. So it is a link between the health agent, the social people, and all those people who come for home visits. And there's another constraint we had is to make sure that our national educators can find out if the children who come from other children have been going through that stimulation checks. And we have now included all that in the register follow-up of the child to see if the child who went to the hospital in this department was actually submitted to stimulation and everything else. As regards the tool, which is support to all that, and the tool on which we are based to work, it is a tool which is called Hope for the Children, and it is a tool which is parentality tool for parents in parents having fun, and this is a tool which is directed to parents and children, and we talked about it later earlier on the map, which is integrated in the child's book, health book. So when the child ends up in hospital, there's there are data in there so that the hospital staff can see what's wrong with the child and what they can learn about that child. Thank you.
Merci beaucoup. Thank you very much. There are several questions around measurements, and maybe just looking also at the time. But maybe if I can give the floor to Lebanon, because we know that Lebanon also is quite innovative, and there is also measurements, including biomeasurements. If Bayan, you could give us a little bit on the tools for measuring and tracking development of children, that would be great.
Okay, so just to let you know about what is being implemented in Lebanon. So we have all the primary healthcare centers in Lebanon are screening centers for acute malnutrition, and we have designated PHCs for treatment of acute malnutrition. So at the community level, what is being done at the ECD corners is that the frontline workers or the counselors, they are trained to take the MIAC measurements for the children. using the MUAC tool that I showed in the slides. And they follow the cutoff points for the acute malnutrition, and they refer any case that is being identified as moderate, severe acute malnutrition or at risk of malnutrition for the nearest primary healthcare center to be followed up by the nearest healthcare center. We also take the height and weight of the child using the height board and the weight scales. And here I wanted to mention also that also the team can also do can be mobile, so they can they should not also stay at the ECD corner. They also go to the community and do the MUAC measurements and the growth monitoring at the community level. So they take the height and weight of the children and they calculate the Z-score using the growth charts, and they also refer the child depending on the results of the Z-score. These are the measurements that are being taken usually, the MUAC measurements, the height, weight, and we also screen for edema, if there's an edema, if the child has edema, and we refer accordingly to the nearest PHC for follow-up and the treatment centers for treatment. Let me know if you need to know anything else about the measurements and the screening.
Thank you so much, Bayan. Andrea, do you want to ask? There are a lot of questions in the questions and answer box, but we'll try to answer a couple of them more, and then those, if we don't have enough time, we are not going to, then we'll definitely answer them and all of them and follow after this webinar.
Thanks, Eduardo. Yes, I'm going to take advantage of Bayan's open mic. Here we can see, we want to know if Lebanon can share with us measurement of impact. This because that would help like a lot of countries in case of any investments. So is that possible, Bayan? Do you have this measurement of impact?
Okay, Andrea, you mean the impact of the ECD interventions, if we are measuring this, the impact of the ECD interventions?
Yes, with the integration with nutrition.
Yes, so for IOCC, I will talk about IOCC in specific. We usually do like surveys for the beneficiaries that received our interventions, and we check with them the impact of our interventions. And also because we are working with the children at different age, so we are tracking the progress of these children from 2 months till 5 years. So we can check also the progress of the child from 2 months and up to 5 years. So either if we have these two ways of monitoring, within the activity, we can check the progress of the child after our interventions from the age of 2 months till 5 years. And also after receiving our activities, we have the like a monitoring from the meal department about the satisfaction of the beneficiaries from our interventions, and if the impact of the interventions on their children, and we received their feedback, and they were all positive.
Thank you, Bayan. Eduardo, please, can you?
Yeah, maybe the same question also for Madagascar and the way of they measure and they follow on the children. And Jadiel, tu veux aussi parler peut-être des interactions simples?
Xavier, maybe you can talk about simple interactions. Yes, we measured the children with a tape. And we measured the size, the the height as well, but also to detect malnutrition. We also try to research the growth, follow-up of the growth on this curve of weight and health, and monitoring the growth is done by the community centers and by the community agents. And when they see the measure, the weight and height, they refer the child to the health center for decisions to be taken.
Thank you so much. Merci. Maybe one more question there. Once the developmental delays have been identified through the milestone assessments, could you tell us what types of early interventions are more effective in maybe in both in Lebanon and in Madagascar? Let's start with Lebanon, and how they coordinate across the different sectors. How do you bring the different sectors, health, education, nutrition, protection, to support children that had been identified with developmental delays?
Yes, there's a lot of interventions that are being done, multi-sectoral interventions that are being done. So, for example, I can start with the food security or the social protection programs. For example, if there's any identified case, we can refer these cases to receive food vouchers or food parcels, for example, or they can usually, for example, if we have a case that is at risk of, for example, malnutrition, for example, let's say about malnutrition, we refer them for WFP to receive food assistance, for example. And we had at IOCC a social worker that tried to refer all these cases to receive the needed assistance. If it could be cash programs, it could be food parcels, food assistance. For the other sectors, we try, for example, also to coordinate with the WASH sector to make sure that these families have access to safe and clean water, and also to hygiene assistance. For the health, I mentioned before that we try to refer them as soon as possible to the nearest PHC to receive the needed healthcare needed. We also refer them to hospital if there's a need for inpatient treatment. We also have the initiative, for example, the baby-friendly hospital initiative. So as a preventive also measure, we are working with hospitals to implement the baby-friendly hospital initiative, where they are promoting breastfeeding as part of the malnutrition also prevention. Other interventions, they could be we are referring also, for example, children with disabilities for other organizations or disabilities that are being followed up. They follow up on such cases. So whenever we detect any issue related to child development and nutrition, we directly refer this case to other organizations or other entities providing this kind of assistance, and under all sectors. It could be health, it could be social protection, it could be food security, it could be also protection, it could be WASH. So depending on the issue, we do the referral to the other entities. And that's why we have in the milestone cards a part that is related to referral, and in every section we have a part that is related to referral to make sure that the counselor is referring this child to the needed assistance and as per the assessment being done.
Thank you, Bayan. Do we have there is an interesting question on the question and answer also. How do we know that there is an improvement on the children that are receiving or they are benefiting from early childhood development programs, do we have any comparison between the children who participate and those who don't participate in those programs?
We try to have a comprehensive, whenever we are reaching a child, we try to deliver a comprehensive package for this child. So we don't have children that they received, for example, ECD interventions and other children that did not receive these interventions. So that's what I mentioned before, that the ECD interventions are not strictly provided at this ECD corners. They are being also provided at the community level to the children. So whenever we are reaching these children, we are making sure that we are providing them with the holistic package of services that is related to ECD. But how we can compare or to measure the impact of our interventions, it's related to the follow-up visits and seeing the child at each milestone, so we can track the progress and know that we are on the right track and the proper track, and we are referring this child as needed. We are providing them the services at each milestone and at each age as needed.
Thank you very, very much. I don't want to frustrate anyone. I know that there are a lot of questions, and I'm sure that even some of you, they have questions that they haven't still put on the box. Please do so now, and we will be sure that after also the webinar, we go through all the questions and be sure that you receive some answers. Of course, the Early Childhood Development Working Group that is organizing this webinar is more than willing to support and to continue during the whole year of supporting and trying to engage with you to enhance programs on nutrition and early childhood development in emergencies. And you will receive also the presentation and the recording of this webinar. As Sania is saying on the chat box, we will address the questions that have been unanswered, and we will share with you all. So right now, then what we are going to do is I'm going to have the pleasure of closing this incredible webinar, thanking very much the presenters and our colleagues from all over the world, but the presenters from Madagascar and Lebanon that represented civil society, government, and United Nations agencies. We have speakers of the three groups. You are going to, right before we close, you are going to show on the screen is going to pop up a poll that we encourage you all to answer. It's going to take a couple of minutes to just click quickly what is your answers. So that will help us to improve and to continue these kind of activities, to be sure that we share knowledge, we share the tools that and more tools that are available for all programs, and hopefully we will move forward and up this very important agenda of early childhood development de la première enfance. So we are working to improve those responses, particularly in emergencies all around the world. Thank you, everyone, and stay tuned. We will be we are there with you. We are all together for this agenda. Thanks, everyone.